able to fill you in more on what that looks like. Tomorrow, the fire department and the city staff are going to be primarily covering the parking lot and making sure that there's safe movement throughout the parking lot. So I see that I have Bill Haig working on Saturday. Let me start with Friday's list. Where there's going to be 4 people working the parking lot area to make sure that all of our seniors and all of our folks get ample direction on where to park and any assistance that they might need getting from a vehicle to the building. So that's kind of what our primary responsibility is going to be. It should be fairly simple. There's a good plan in place for that. Matt Steffi, he works for the Parks Department for the city. I've kind of put him in charge of the operational side of that. And I will kind of be floating around just to make sure if there's any needs, I'm available to help fill in any of those categories. Tomorrow, starting at the 8 o'clock hour, I don't know that I have any of the Rotary folks listed. Check the afternoon. In the afternoon, Clyde Bear, is he online with us? All right. Hi, Clyde. Nice to see you. I see you're going to be coming in around 3 p.m. and working to the end of the shift that day.
Yes.
When you get there, you'll get a little bit of an orientation on what it is that we expect. It's not going to be a lot, but if we need to have a checkpoint as people drive into the lot, just to make sure things like we ask them, when is your appointment? And if their appointment's not for 45 minutes, we might have them staged somewhere else because the traffic flow will be pretty consistent throughout the day. Because the way this is broken up into the timeline, they're looking at probably 45 patients being seen in an hour. So if that's happening inside, then something similar is going to be happening outside. So that means traffic flow will be somewhat consistent.
He has his vaccination at 2:30, so that's why he can't do it till 3. So
okay, yeah, no worries on that. Anybody that's helping, we're going to try to have them park in the lower parking lot by the daycare side of the church. I don't know if you're all familiar with that area, but it'll be the very first entrance, and I believe we'll try to have some signage that says like either employee parking or staff parking or something like that alerts you that that's where you would park as a helper. And then when you come up, you'll meet with either myself or Matt Steffi, who will give you kind of a quick brief overall of what we need from you. There's going to be like 2 or 3 different positions in the parking lot. One will be a person to greet cars as they come in to verify the time of their appointment, ask them if they need any assistance getting from their vehicle to the building, things of that nature, so that we can make this as smooth of an operation as possible. Everybody will have a portable handheld radio that we use here at the fire department so that we can converse back and forth to make sure that we're good with all that and that stuff goes seamlessly. Obviously, in the morning and the afternoon, it's going to be dark. If you have a headlamp, bring one. If you don't, we'll try to find one for you. And then I will have some lighted kind of wands and things of that nature to help direct people in the darker areas of the parking lot. It is a fairly dark parking lot. There's only one light that I could see in the parking lot on the building. So we're going to try to assess that this afternoon. And if there's a way for us to put auxiliary lighting up without having it be blinding to the drivers, then we'll try to figure out a way to make that happen tonight. Otherwise, we have things like safety vests for you to wear. If you don't have a headlamp or a hand light, we'll provide you one. If you have your own, that's great. I would also consider bringing some, if you have them, bring some ice cleats or something to help with the traction if it starts to get icy. We are going to have a truck there to sand the parking lot at the beginning of the day and hopefully have them on call throughout the day just for that purpose. We will have a few wheelchairs on standby there if we need to actually help somebody from their vehicle to the building via wheelchair. We'll be responsible for that. Our team will be responsible for helping with that. So just understand that could be a possibility as well. I'm scared that it's going to be a cold, blustery, wintry day, and it's not going to be very much fun for us. But I think the overall outcome of this is going to should be warming to the heart, right? So let's make sure that we look at it in a positive attitude. and do the best we can to get through it. But if you feel like you're not feeling well or you've had enough, please don't hesitate to say something, and we'll try to find a substitute at any point in time that day. So, yeah, I see, Clyde, you're tomorrow afternoon. Then I have Bill, I believe Bill Haig. Bill, are you on there? Can I see your face, a wave or something? There you are. How you doing, Bill? We'll get you online Saturday morning and give you another brief outline of what's going to happen, kind of what I just said, but there might be a little bit of a detailed change between now and then. There's been a lot of changes in the planning phases of all this because it has happened so quickly. The logistics of this vaccine and how to handle it and the timelines for it make it a very fragile process, so that we're trying to make sure that we do things as safely as possible and make sure we get the greatest benefit out of the vaccine and the operation. So tomorrow is going to be our pilot day, and then hopefully everything after that gets smooth sailing. That's going to be our goal. So we appreciate all that you're doing to help in this effort. And if there's anything that you have for questions, I'm happy to try to answer them now. And otherwise, I would be able to help you on scene in the morning. So,
Chief, I have a quick question.
Sure.
If people are signed up as door greeters or second appointments, Dorotha will give them their instructions. Is that right? And
that's my understanding, that either Dorotha or somebody from the clinical staff will give them that direction.
Okay. All right. And so if people are working in the parking lot, they should look for Matt tomorrow. Is that correct?
Either Matt or myself will be there, or bright and early and there throughout most of the day. I might have to come and go once or twice throughout the day, but I'll be there both days to try to be as reachable as possible.
Great. Thank you.
Vivian?
A quick question. I'm on for a Saturday afternoon. So the schedule said 1:15 to 6:30. And is that correct? You have me down?
Let me find you there.
Yeah.
I am looking.
Anyway, it's a long shift. And as you said, that there are places to take breaks and get warm and use the bathroom and so on.
Yes, there is that. And Vivian, I know I saw you. I thought I saw you somewhere on here. Did you sign up for helping in the parking lot, or were you inside somewhere?
I don't want to be inside, so I'm in the parking lot. Yeah. I mean, I don't want to be outside either, but I don't want to be inside.
Right.
I'm pretty sure that you have her, Chief.
I am looking right now. Vivian. And what day was that? Friday or Saturday did you sign up for?
Saturday.
Saturday, okay. Oh, there you are. Yes, I'm sorry. I see Bill working until 1300 and then you starting at 1300. So yes, you are there Saturday afternoon, and I do have a kind of a backup fill-in person. So if you need to take a little break, we have that, ability. And if it's just absolutely too atrocious of weather and it's not something you feel comfortable with, don't worry about it. We got it covered. Okay.
Great. Thank you.
Chief,
Yes.
I'm Kathy Hill, and I'm signed up to be a greeter on Saturday afternoon. And the question is it an inside or an outside job?
I believe you're going to be inside. I don't have the schedule for the actual greeters in front of me. I don't know, maybe Dorotha has one in front of her.
I will chime in, and I don't have the schedule in front of me, but I'll answer that question that I don't really know that answer, Kathy. We are meeting at the church at 1 o'clock today, and Chief
Okay.
might know. Is there a foyer there, Chief,
there
that
is.
the greeter can stand in the foyer and do some work so that they're out of the wind and everything? Because it's a fairly long conversation that you're going to have. I have a script that begins with, I don't know if I have my most recent version printed out. The script is is basically, it's like you're acting like you're at the front of the hospital. Be friendly, smile through your mask, speak loud and clear, welcome people. Do you have an appointment for today? If yes, what is the time? Are you experiencing any COVID symptoms? And we have all the symptoms on a board. Will you make yourself available February 12 or 13 to receive your second dose? Have you traveled outside of Alaska in the 5 days prior to your appointment? Have you had close contact or shared living space or been within 6 feet for 15 minutes with a COVID case? Have you been tested for COVID? Have you received any type of vaccine in the last 14 days? We all know that some of those questions happen quickly and some you get people's life history, right? So the conversation might go from anywhere from 2 to 5 minutes, depending on who you're talking to. Then please don a procedure mask for the duration of your visit and go straight to the registration table. So that interchange is what happens as a greeter. And so I don't know until I get there at 1, unless Mark has already made the decision, whether you'll be standing outside to do that, in the foyer to do that, or actually in the lobby to do that. I don't know.
Thank you.
And based on the latest map that I have of the building, not the parking lot, and I'm going to try to give you a picture of that. This area right in here is the foyer. And I believe that's where inside the first set of doors is where the greeter will be.
Good.
It
That's
wasn't
what I was
100% decided the other day, but I think looking at the map, it makes the most sense. I
Good.
don't want people outside if they don't have to be outside,
Right.
especially the helpers, you know, everybody in general, but you're going to have paperwork to deal with. There's no reason to be out in the cold and in the snowy conditions. So I think you're going to be in there, and I think there'll be a table set up in there, hopefully a thin table, no table.
There's really no need for them to have a table, but anyway.
Well,
Sure.
I thought for PPE purposes, if people didn't have a mask and there was
Oh,
a
okay. Fair.
hand sanitizing station,
Yeah.
there would be something there for that purpose.
Sure. Yeah.
Um,
And it would only be one at a time. And so we'll have to make sure and have a sign on the entrance to that area. Please wait to be motioned in, to be invited in. So it'll just be one at a time in that area.
Yeah. And that's part of the job of the parking attendants to say, stop at the front door, don't enter until you've been waved in,
Yep.
something of that nature, so that they get the message probably twice.
And that is something that I wrote down to make sure everybody understands that people are going to be asked 2 and 3 times the same things, and they're going to start possibly getting frustrated. But because we are a rotating shift of volunteers, we cannot risk something getting missed. So we're just going to reiterate everything. Every time you interact with somebody, you're going to be told hopefully the same thing, but you're going to hear it multiple times. Okay,
Right.
I'll be quiet.
I have
Any other questions for the parking side of things that I can help with?
Right. I'm just curious. I signed up for Saturday morning. I have no idea what I'll be doing, but I don't mind dressing for it. I live up on the hill, so I've got battery operated gloves and lots of warm togs to wear and boots.
And
No,
what,
I think you're signed up as a door greeter. You're
Okay.
signed up as a greeter.
I'd be inside.
inside?
Yes.
Okay. I mean, I don't mind being out. So
Inside, but at a door. So it's not going to be warm and cozy. You're at a door in an entryway.
appropriately, I'll be ready for it.
Every time the door opens, a little cold air is going to come bursting right in there. So be prepared for that.
Wind. I predict that. We got a blizzard coming for sure.
And I
Yeah.
think Beth has had a question.
Well, I don't have a question. I just wanted to let everybody know that I had talked with Matt Steffi, and he's going to be borrowing a couple of our outside heaters to bring over there. So we've got a big tall propane heater that puts heat down, and we've got one that warms hands, a smaller one. So those will be available in the parking lot, and we have 2 more that we can bring over if need be. So I just wanted to let you know that there would be some kind of
Great.
heat outside for people to warm up under.
Right.
That'll be fantastic. I think right underneath the awning part of the church, before you go into the vestibule, there's enough clearance there that might be a place where we could put that to help keep not just the helpers warm, but even the people standing by for their
Right.
turn.
Right.
I was going to bring some tents and try to do the same thing with some like just 12 by 12 covered tents, but I think it's going to be snowing enough that might not be a good idea.
No.
Or otherwise I'd have to have 3 more helpers with ladders to clean the tents off, and that's just not doable right now.
Chief Kirkwood, thank you so much for your time. I know you're on a tight schedule, and so is there anything else for the chief before he has to go? Okay, thank you again.
All right. Thank you all so much. Appreciate everything you're doing to help out in this effort, and I look forward to meeting up with you tomorrow. Take care.
Good, thank you again.
Bye.
Bye-bye.
And now we're going to turn the program over to Dorotha and Lauren Carroll. Thank you both for being here.
You bet. Lauren is public health team lead here in the Homer Office of Public Health. Help me, Lauren. Division of Public Health, part of Alaska Department of Health and Social Services. How's that?
Well, that's one way of saying it, and that's correct. I'll take it.
Woohoo! Okay, great. So I promised you all that we would do a presentation on vaccine. And when I promised you that last Thursday-ish or early week, I thought I was going to have more time to prepare, but I've spent nonstop for the last 6.5 days working on the vaccine clinic. So I have pulled together some slides that I would like to share. And this is a little bit of co-presenting because Lauren is going to possibly help me with some things. So do I have screen sharing on? Let's see. Did you guys see that vaccine? Where's my screen sharing? Share screen. There we go.
You got it? Okay.
Okay. From beginning. So do you guys see a screen that says COVID-19 vaccine update?
Yes.
Yes.
Okay, perfect. That tells us what we're going to do. So the 3 things I wanted to accomplish was talk about this weekend, which we did a little bit already with Chief. So I don't think we have to do much more with that. And report out on vaccine status. And then I want you all as Rotary to help me solve a problem. So Lori, can you tell me how much time is dedicated to this process?
You know, and we have until 1, you know, and we hope you'll leave time for questions, but you are our program. So
Okay, and is there Rotary business that has to happen?
we've already done it.
Wow, okay,
We're
okay,
trying
great.
to move through this.
Okay, so here is the current COVID cases for the state of Alaska. We are still in the red high alert, which it's based on the number of cases per 100,000 population. But you can see that we've really, as a state, we're really dropping. We're still well in red, and so it's not like COVID's going away or anything like that. But you can see that we're improving kind of back towards fall type. And can everybody see okay? Okay, just be interrupt. And then here is the Kenai Peninsula. And the lines, the Kenai Peninsula is broken up in color lines. So the Central Peninsula, which is, as it pretty much is, the central area, that's the blue line. And the Eastern Peninsula over in Seward area, that's the green line. And Southern Peninsula, that's Ninilchik South and across the bay, that's the black line. And these are your average daily cases per 100,000 population. And this is the 7-day trend of what we see over a 7-day period. And you can see that as the Southern Peninsula, we're very much on the decline of COVID cases. And this is a document, this is a screen that the school district uses in helping them make decisions on schools being back in session or not. So the schools, because you see the decline is so great, for South, the South Peninsula area is moving very close to the yellow red alert. So it wouldn't surprise me if our Southern schools do actually go back to kind of fairly normal school schedules. But in the meantime, they have adopted and moved into what is a red alert version where they are, they've split the school kind of in half, the kids that want to be in session, and they've split them in half. And so they're at 50% capacity. So the schools in the lower peninsula are back in at 50%. And that started this week. And then they trade off week by week on who goes into the actual schools. So that's a caseload look over the pretty much the life of the pandemic on the peninsula. So some of the vaccines that are kind of being utilized worldwide. Here's just a chart that kind of shows the type of vaccine it is, the number of doses it takes, the efficacy rate of the actual vaccine, how they're stored, and the cost of the vaccine itself. And the two middle ones, Pfizer and Moderna, those are the two that are available in the United States and Alaska right now. And this, you know, the information's different at state, national, and worldwide levels. I did read recently that looks like Johnson & Johnson has one that will be possibly available soon that is actually a single dose. And so there's lots that are kind of on the launch pad and even further along in the process. So this is always going to be getting larger. The list is always going to be getting larger nationally and worldwide. This is a vaccine dashboard that the state has available. Anybody can go on and take a look at it at any time. You see that the upper right corner there, that shows how many vaccines have been allocated to the state of Alaska so far, and the breakdown of which ones were Moderna and which ones were Pfizer. Again, both Moderna and Pfizer are two-dose regimens. And then it shows you how many people have received at least one dose, 35,000, and close to 8,000 have completed a full dose. So we're getting there. We're inching our way. And after this weekend, those numbers will be much larger in the number one dose, because not only is Homer doing a mass pod this weekend, but also Mat-Su and Juneau are as well, and actually Fairbanks. And so I think the Alaska Airlines is having another one too. So there's a lot of mass pods that are happening this weekend for first dose rollout to the seniors. And so that number, that 35,000 number, that's just going to keep creeping up or moving up very quickly after this weekend. So as far as Homer, the hospital, the staff there, I'm sorry, I did not write SPH. As far as Homer goes, 214 hospital staff have received both doses. So they've received the full inoculation for COVID-19. An additional 57 have received the first dose. So we are at over 270 employees have received. And right now, that's pretty much it for those that are eligible. Anybody who's eligible, who wanted it, that works at the hospital, has gotten it. We have a lot more who want it, but they're not eligible. You have to have met certain criteria to have received it. We've done all of our long-term care residents. All long-term care residents have received first and second dose. The side effects for the clinics because we, South Peninsula Hospital, we administered all of those numbers above that I'm talking about there. And the side effects have been what we expected, and they were all handled just fine on site with no unexpected or unusual situation. The community event that's coming up this weekend, this is our first step into what is called Phase 1B, Tier 1, and that is the individuals 65 years of age and over. And what we have for this event is 600 of the Moderna doses. And those were shipped and we've received them. They are on site now. And the history shows us, those big 200 that are above us already, our history's so long, you know. History shows us that we can count on an extra dose per vial. So since there were 600 doses confirmed to us, we then added 60 for the anticipated extra dose per vial. And we had at least 40 remaining doses from the vaccines above that we did for staff and community healthcare workers last weekend. Therefore, we were able to do 700 appointments for this weekend's event. So just in general for the state rollout of vaccines, you know, we started with no vaccine, and then there's very limited availability. Then there's limited availability and widely availability. So it's hard because there's a different chain that's eligibility oh, limited people are eligible, then more people are eligible, and then there's lots of people eligible. And those don't all follow in line together. So like you can have a lot of people eligible for the vaccine, but the availability might not be there. And so that's where we are right now, that we have in our Southern Peninsula, we have 2,700 individuals over 65 years of age who are eligible, but the availability is way back at the beginning of the very limited availability. So I cannot control that. That's just so everybody understands. And we're not unique in the state. The entire state is dealing with the same exact thing. So we can look at it locally or we can apply that statewide. So who is eligible now? The persons age 65 years and older, as well as everybody who became eligible earlier in January and in December, which are the healthcare workers, the frontline EMS and fire service, the nursing home workers and residents, and any other folks that are doing the vaccinations or community health. And then next, who is eligible next? So the arrow is pointing to the group that we expect to become next, but next probably isn't going to happen for a while, because back here, this 65 years and over, we've got thousands still to vaccinate in that group. So here in the next group, when we do get there, it is frontline essential workers aged 50 years and older, and people living or working in other congregate settings that weren't covered already. And so a breakdown of who that is education. So pre-K educators, school staff, childcare workers, support staff, that's public safety, troopers, firefighters, anybody that's a first responder, food and agriculture, seafood, food distributors, grocery store workers, public transit. That might be a taxi cab driver, a airline pilot, U.S. postal workers, utility and power workers, wastewater and water workers. So frontline essential services, that definition was developed way back in April when testing was very, very limited, it was a limited resource. And so for testing, the state really established really clear guidelines on who was eligible and that frontline essential services workers definition. So remember, I'm going to go back a slide. Remember, they are in phase 1B, tier 2. So they're not eligible yet. They become eligible after all of the senior citizens who want it, get it, okay? Okay, so what if someone has had a vaccine in the last 2 weeks, but you come to the vaccine clinic here or anywhere throughout the state? Just so you know, CDC does not recommend getting the COVID-19 vaccine within 2 weeks of other vaccine. They do not have enough data to really understand the safety of it or if it impacts the efficacy level of it. So they recommend not doing it. Are we going to refuse you? No, but we're just going to let you know that it is not recommended. Who should get it? And if there are contraindications, the CDC's document says that it has a long list of kind of who shouldn't. It really boils down some to allergy or other illnesses. And this is why we have Lauren on the call in case there's quick questions beyond this. I mean, there is a list of who shouldn't, but you probably know by now that you should ask that question. Should I or shouldn't I? Also, specifically for the severe reaction, like if you have a history of anaphylaxis reaction after a previous dose of a vaccine or allergic reaction to other to ingredients within it. So, you know, any kind of history like that is a red flag. So once you get the vaccine, will you still have to wear a mask? Yeah, with the current information, yep, you do. Again, we just need more data on people getting it and then whether or not they're spreading it or not. There are other vaccines that vaccinate for similar respiratory type viruses that do prevent the transmission. Yes, it prevents the illness, the disease from manifesting in your body, but it also prevents you from transmitting. But we don't know yet on this one, and so the jury's still out, but it's looking promising. If I get vaccinated, do I have to comply with health orders for travel? Yes. So it doesn't matter at this moment. It doesn't matter whether you're vaccinated or not. You still have to follow all the rules. You know, as more people get vaccinated, things might change. But at the moment, social physical distancing for after 5 days upon arrival into, you know, into the state, having a test, et cetera, that all still has to happen. So this weekend, the event is City Unified Command. It's by appointment only. There is a wait list of over 200, and like last time I looked, I think they've pulled out a lot of doubles. So I think and they've actually started calling people and moving them onto the appointment list. So I still think we're above 200. So there is a wait list, but it's full. We're not putting more people on the wait list. This is a mass event. Don't walk in and expect private cubicles or exam rooms. Don't expect a 45-minute personal conversation with your doctor. This is a mass event. It's very much a assembly line. You'll go to one till you'll get greeted, then you'll go to the next table and get some forms, and you'll go to a station where you'll sit down and fill out your forms, then you'll go to one of the 10 vaccination, what would we call them, stations, and then you'll go to a group setting to sit down and be observed. Yes, it will all be appropriately spaced for COVID mitigation. And yes, it will, you know, so there won't be risk for COVID spread, but it still will be a very mass group setting. We do have a few stations that have the personal screens around them so that they're totally private, but I can't guarantee the type of privacy you would get in an exam setting. People should expect at least a 30-minute visit. There's going to be repetitive screenings. You're going to be asked 11 times. Are you over 65? Do you have allergies? Do you have this? Do you have that? So like, I'm sorry, but we just have to make sure that there's no way for folks to slip through the cracks. So there's just going to be lots of repetitive screenings, and you must book your second appointment on site, and we will have helpers there helping people do that. So I will ask Lauren if he has any follow-up information that he would like to share. That's the first time he saw those slides. Okay, go Lauren.
Oh, wow. Let's see. Maybe I'll just limit it to a couple of small comments and then happy to take my best shot at any way you folks would care to use me. I guess I would say number one, as most of you folks know, we've got about 15,000 people on SKP. So these initial allotments of vaccine only represent, you know, very roughly 4 to 5% of our population. And I'm pointing this out because when you hold up 4 to 5% of our population for a vaccine that's really meant to decrease the number of deaths and hospitalizations, it's not really meant primarily to prevent the transmission of COVID virus. It's meant to decrease hospitalizations and the burden on healthcare. And when you hold up the fact that only about 4% of SKP is getting their first dose, 1% of Alaska has completed their entire series of 2 doses, and then hold that right up next to the total number of reported cases in Alaska. So we're sitting at about 4 or 5% of the state has reported to have had COVID-19. So the point here being is that we've got a long ways to go. And I imagine there's going to be several unexpected turns and twists in our path moving forward. So I think that vaccine is going to be absolutely key to ending the pandemic, but I think we're in for a long haul.
Mhm.
Okay. All right. Happy to answer any questions.
DeRotha, this is Carol. Hi. Thank
Hi.
you again. Thank you again for all you've been doing, and then some Herculean efforts by you and the whole team. And Rotary volunteers, thank you this weekend. Question, for those of us that have appointments this weekend that are coming as twos, a couple, and I have an appointment like at the hour at 1 o'clock, and the partner has one at 1:15. are we able to walk in at the same time, or are we going to be, because of the different stations? I'm assuming we're split up at some point because of the different stations, but are we able to enter at the same time?
Probably not. The intention is no. That it will, that anybody coming in will only be somebody with an appointment within the next 15 minutes, and then moving. So probably not. Yeah.
Okay.
Thank you.
Thanks.
And
Good to know that's
I also failed to say, because it's 12:38, I do want to reserve a solid 5 minutes when we're done with questions I want you to help me brainstorm a better reservation or appointment system for next round, because I know that you all were part of it. So we'll take at least another 5 minutes of questions, and then I would really, really love to just have a quick work session. Okay, Bernie.
Yes. Given what you said, we should arrive, if you have a 15:45 appointment, you should arrive around 15:30. That's 3:45 and 3:30 in English.
You can arrive and stay in your car, but you can't walk up to the door. I'm gonna stop talking. I have no idea. I can't look at the clock that fast. So if somebody's so for the 9 o'clock appointments, right? We're starting at 9, we're going to start letting those people in the door before 9 to start the first group of 10s to move. So, I don't know, don't come more than 12 minutes before your appointment, I guess.
Okay.
Yeah. I mean, come and park, but come up to the door at about 10 minutes before. And my goal, I have a radio, and I'll be inside. We'll have a PIO inside, and our job is greeters and connecting information to the outside. And so I'll have a radio, and I'll be talking to those folks working the parking lot. And I'll radio you, and I'll say, we are running 20 minutes behind, or wow, we're really caught up. Start sending even 10:30 group in, or, and then that'll be your job if you're working the parking lot to share that accordingly. So I will definitely I'll be the communicator to that parking lot.
Dorotha, I'm getting my injection, my vaccine. How long will I be waiting afterwards before I can properly go out and be directing traffic?
Great question. When I heard that earlier, Clyde, I paused a little bit because, if you report that you have a history of other allergies, like to penicillin or those types of things, you'll probably be asked to stay in, for a full 30 and be observed. If you don't have a history, it's a full 15. So anywhere from 15 to 30 after you get your dose. Mm-hmm. And I see that you scheduled yourself based on your appointment time, which is no guarantee when you're honestly going to get your dose. So you might give the heads up to the person you're replacing that you might be even 30 or 40 minutes late. So as far as side effects, for the most part, what we learned with that first round, for the most part, people don't have immediate side effects. So you probably should be fine for the next couple hours to go out and work. But people too report that evening having a very sore arm. Some people did report feeling fatigue or headache. So, I mean, there have been physical side effects right here at South Peninsula Hospital that were reported on a light level. So, yeah, I mean, if I were you, I would honestly have somebody in your hip pocket as a backup, just in case, by 2 hours into the shift, your arm is hurting so bad, you really just want to go inside and get warm or something. I would have a backup plan.
Okay. Okay.
Hi,
Thank you.
Dorotha, I have a question. I'm in a sling and I can't write. Is somebody going to help me fill out my forms?
We will.
Okay.
Absolutely. Yep. So we have lots of helpers that are inside, and so just make sure that you bring that to their attention. So absolutely we will. And just on a physical needs as well, we have We have 3 wheelchairs that will be available to help people either come in or in case they need it for a reaction. EMS is on site. And Jay from the center has rounded up some of his crew to be available. So we have a lot of support systems for a variety of needs. Any other questions about the vaccine or this weekend?
Ruth, this is Reed. Are all the vaccines tomorrow, next 2 days, Moderna?
Yes, they are.
Okay.
Yep.
So you're going to try and fit in 700 people in the next 2 days. That seems like quite a lot. And there's 10 vaccinators in the room. So I can't do the math that quickly, but it seems like this is going to be quite a trial. Yeah.
We're hoping to do 40 an hour. So if you average up to, if we can get 9 hours a day of 40 an hour, then that will help us reach our 700. Yep, that's the goal, Vivian. We're gonna do it. So the good news is that we have a couple people that are wearing hats that they can quickly shift to a vaccinator hat. So Nicole is she's our lead employee health nurse, and Nicole is not signed up to be a vaccinator. She signed up to be the clinic manager. But if she sees a really long backup, she can sit down and start vaccinating. So, I mean, we have the ability to ebb and flow a little bit, but yeah, we're really relying on the great news, you guys, is that we have 4 clinics worth of experience. Those 300 plus doses that have already been given out up here. It's the same way we did them. It's just we didn't do them at the church. We did them in one of our conference rooms, and we set up stations, and they booked on the same exact appointment thing that you guys just used. And I mean, it was the same exact system, just on a tiny, tiny level. So we have real-time experience moving people through multiple stations at a time with 15-minute appointments. And it worked up here. Granted, we didn't do 360 a day, but anyway, yeah, it did work. So crossing our fingers.
Yeah, that's not even to mention that not only do we have the experience of these clinics, in the recent past, but our most recent full-scale exercise that our community did was in 2018, and I think that was a real success. And all these skill sets from city workers and hospital workers in particular are very transferable to this weekend. And so when you look at these folks in the eyes, when you're just about ready to get the shot, you'll see a lot of confidence there, because these folks are doing what they really like to do.
Mm-hmm. That's good. We have several school nurses that are helping, and just a lot of depth in the community. Yes, ma'am.
So you're talking later about how to make the scheduling more efficient. How just to get an idea, how were there 40 people signing up for each spot? When you click on a time, was there 40 times of that time available?
It's the same exact software we use for health fair. So just like for health fair, we sit and we say, okay, we're going to have 20 people an hour come, or 10 people every 15 minutes. You tell the system how many spots it allows, and then that's how many appointments it allows. So yes, we had programmed it. So full disclosure, we programmed it for 9 every 15 minutes. And we saved 1 spot every 15 minutes that was for people who had told us they did not have internet. And then we had some folks on the phone helping those people for that other 1 per every 15 minutes. So 9 per 15 minutes were completed in an online module. 1 every 15 minutes was completed over the phone.
Rosa, Kathy speaking. Online, did the public receive information as to what the procedure will be when they get there? like this repetitive screening business? Do they know they're going to be doing that?
They don't. So I'll answer the first question. The goal was that they received the information, but what we learned was somehow there was a snag in the software. I don't know if it's because we hit it with so many people at the same time, or I haven't had breathing time to troubleshoot, but somehow at least a third, if not a half of the people did not get their confirmation email. And so as people have been calling me to complain that they didn't get a confirmation email, I read it to them or I send it to them. And so we've been slowly bringing that number down. As far as people being told that they're going to have to give information multiple times and answer the questions multiple times, I did not put that in the confirmation email. It was already so long with what to wear, and that if you're sick or have any symptoms, don't come. And that it was already so long, I did not add that. And so I'm going to rely on the greeters, you, to remind them when you're welcoming them that, and guess what, you're going to be possibly asked these questions again as you go through. And thank you for your willingness to answer them again.
Thank you, Dorotha.
Mhm.
Good job.
Okay, so it's 12:49. If there are no objections, jump up and down or go crazy if there's an objection. I would love to just, I think I've heard all of the problems, I think, of the online scheduling and the inequity of having to have a fast internet and your fingers can't type fast enough and they were all gone by the time I got in there, or I made my appointment and then by the time I went back in, there was none for my spouse, or mine's on Saturday and my spouse is on Friday. And like, there's like a list of 100 things that went wrong with this situation. The problem is every solution I have is worse. Like, I just can't come up with a better, like a phone. Like if we tried to set 700 or 1,000 appointments by phone, I have no idea how that would come out equal or fair. If we use the state's scheduling module that they've made available to us, you have to put your medical history in, you have to scan your medical cards, you have to put your social security in, you have to go through so many screens to learn that there are no appointments available for you. Like, I just don't know what solution to provide to the community. I really don't know what to do. Okay, Bernie, go.
Well, the first question, how long did it take from 12 o'clock on to fill all your appointments?
Under 8 minutes.
Okay. Congratulations on being able to do that without crashing, which is.
I
really-
was so afraid.
The credit for that. I did have a little frustration by the time I finally got an appointment, but by the time you fill in even the information you had, boom, it's gone. So
Yep.
you have to be really quick typist, but I'm not sure, looking at it, how you can really meet the requirements that you have to have and still make sure your system doesn't crash on you. But I think that's pretty consistent right now.
DeRosa, Will. First of all, I'm impressed with the senior citizens in the Homer area that 600 people were able to figure it out so fast. That's one thing. But secondly, it would seem to me as you do the next one and maybe the next one, you're going to get fewer and fewer people that are dying to get in there so quickly. So it seems to me that if you leave it alone, give people a start time, and people have figured out that there's a problem. And I really like the way you set aside one slot per 15 minutes for the phone people, because at least one of our Rotarians couldn't even get in on the phones, but maybe leave 2 slots for the phones or something.
Mm-hmm.
But I think the system worked really well. So
thank you for that perspective, Will. That's good. That's good perspective, that each round there's going to be fewer people buying. Charlie?
Yeah, the thought popped into my head. People are getting their shots this weekend, and they're going to need their next dose, in 21 days or so. How will you set it up so they'll have priority to get appointments for that follow-up shot?
There is a special event that is just for them, and their appointment will be made before they leave. So all 700 people are making their appointment before they leave.
So
The rest-
I'm a bit naive about the whole software thing, obviously, but when you click on an appointment, then why doesn't it just let you have that while you put in the information 8 times? You know, because 8 times I put in the information and the appointment was gone after I'd clicked on it. So, you know.
I hear you. I don't really know. Oddly enough, this is such a great moment in history.
You want me to answer?
Will's going to answer it for you. So this software is the software that we Rotary chose 10 years ago, Will? 10 years ago?
Yeah,
to do Rotary Health Fair appointments on. And so it's just to Will's comment, that is why 600 people figured it out, because they've used it for years at health fairs, so they're familiar with it. But I'll let Will respond to some of that.
So the short answer is this is a database, and the way databases work is multiple people can get into a database at one time, into one record. So when you click on an appointment at 7 or 12:15 in the afternoon, there could be 6 people that are looking at that same record. Whoever hits the submit button first of those 6 people is going to get it. So only one person can change a record at a time. So when you have a high density of folks trying to get into one record all at the same time, then the first person to hit the submit button is going to get it. That's just the way they work, because you can't have 2 or 3 people changing the same record. So it locks, you can look at it, but until you hit the submit button, you're not going to get anywhere.
So with a shake your head or make movement, did you log on and attempt to get an appointment? Okay, there's some movement out there. So how many of you tried for Friday morning? Okay, so maybe in the next round, I need to put in the instructions, like go for Saturday afternoon. And then that would solve, this is really helpful, Will, to understand the behind the scenes, because everybody was vying for those same couple cells that were Friday morning. And so maybe if we somehow get people to shoot for Saturday and Friday evening, that would help resolve that too. The issue, it doesn't help open up appointments, but the issue of it not being there when you get there. Okay.
Essentially, that's the correct answer. If you try Friday, like around 1 o'clock, and you don't get it, then don't waste your time on the rest of Friday. Go to Saturday.
Good.
Yeah.
Okay.
Hey, Will, I got a question for you. If you open up the system, you find the appointment you want, and you click submit before you enter all your information, will it give you an error message and let you then get your appointment, but then go back and complete the information?
That's an interesting question. I think it will give you an error message, but I'm not sure.
Yeah,
Okay.
guys,
There's
when
not
I
much-
filled on, I'm just going to say, if you have autofill, it only took me like less than a second to fill out all that information. So I don't understand why anybody's having trouble. I clicked in, I put the first letter of my name, and it went bing, and I just clicked and then get me an appointment. It took 2 clicks and I was done. So maybe you ought to do autofill.
DeRotha,
I was trying to sign in, and Tina's signing in on her computer. I was using my iPhone, and she was able to get her appointment, and then I was having to go back because mine came up as that wasn't available, and trying to re-enter all, and she had autofill, and she got an appointment for me just right away because it was almost instantaneous. So I don't know if there's a way on phones to be able to do that autofill, but that would be an instruction that would take a lot of, frustration from people. So Anyway.
Dorotha, this is Carol. A couple of thoughts. I wasn't aware ahead of time that we were going to have the ability perhaps to make our own appointments. I just assumed that we were going to go in and be given, and which was going to be fine with me because I'm so grateful to have any appointment. I wasn't going to care when it was. So when I went on, the first one that came up, that's fine, whammo, I hit that, submit, and it took. So I don't know if in an extreme future situation, if you could just do away with the appointment times and just let it just populate whatever time and people take whatever time they get, or if that causes, I know it's not going to work for everyone, but what Paul just said is a similar thing to in our situation, where I ended up with using one email address for both appointments, and it was quicker, of course. But then on the confirmation of the appointments that we got this morning electronically, and then that same day when we made the appointment, it didn't have someone's name. So if there's more than one person using the same email address, they may not, I mean, I'm guessing which one is mine, because I who went in first, but there may be some people tomorrow and Saturday, if they're using the same email address, they may not know if they're the 1 o'clock person or the 1:15 person.
Yeah, we've stumbled on that already. Yep.
Okay,
we realized
okay.
that. Thank
But
you.
thanks again. It's just perfect.
Mhm.
At the bottom, this is Tom, at the bottom of the notification that we got this morning for Friday's shot, clear at the bottom, it does have the name and time, because we did the same email for 2 people.
Good to know. Thank you, Tom. I'll tell people to keep scrolling.
Yeah.
Okay.
And regarding
Well, that's interesting because mine doesn't. Mine's not showing our names at all, Tom. So that's interesting.
One thing we did stumble on was that if you closed out and came back in, it made 2 unique appointments. But if you just stayed in there and went to the next one, it made 2 appointments for that one email address. And so some people in your situation, Carol, some people have never received the second confirmation. I've just gone in and looked for them and told them, yeah, you're confirmed. So it's software learning. It's software, not glitches. It's just somehow the way the software is set up.
Regarding autofill, I'm not sure I would advertise that. Some computers, your computers are set up kind of automatically when you buy your computer for autofill for a lot of things. To try to explain that to someone how to set up autofill now, I don't think I could even tell you, because all computers are a little different. So if your computer is autofilling, wonderful. If it's not, I'm not sure trying to explain to people how to change it would be very helpful.
Good point. So the city has set up, because this isn't a hospital thing, and I think that's super important. We all understand this is a community thing, and the city has set up a call line, 435-3188, and that call line is just going to be a recording. And it's going to be a recording to help people stay connected with what's going on and when the opportunities are if they're not online. So the hospital website, SPHOSP.org, will always have the updated information to when the next one's coming and how to get your appointment for it. But because so many have said they don't use computers, we set up the city call line, 435-3188. And that recording will tell people what the next opportunity is when we know when it is, and we don't know when it is. So, okay, I'll let Lori determine the future of the conversation. I mean, I can keep talking, but I'll let Lori decide that. And also, while I turn it, Lori, you're on mute, and while she's unmuting, I will tell her that I will tell everybody that Lori was one of the volunteers that came in to help the city call line do some of the individual calls to folks that did not have internet. So thank you, Lori, for your help in doing that.
Not sure how much help it was, but it's a great learning experience and great to be a part of all of this. And so Dorotha, if you could answer a couple of questions about our volunteering, like on Friday and Saturday. People who are working traffic and parking know that they meet with Matt Steffi. We have door greeters and we have second appointment people. Do they find you tomorrow and Saturday?
Door greeters find me. I'm the coordinator of door greeters. I'm not certain who the coordinator of second appointment people are. And I sure hope everybody understood that whoever's doing second appointment, that is on that lovely appointment software. So I hope that you know how to use it.
Okay, well, and maybe if people have signed up to do or have been assigned second appointments, maybe that is not what you were going to be doing. I just am unclear about what I want to make sure that our volunteers are put to good use, Dorotha. And so who should I talk to just so I can send information out to people?
I will go next door. And where is the, like, who did you give that list to of the people signed up for door greeter and second appointment?
See, I sent the list to Chief Kirko, all right?
Okay.
And then he let us know that that wasn't happening. How about if I send it to you after we meet? So
Okay. I will, we're all heading to the church right now to do a little setup and meeting. And so if you could send that to me ASAP, and then I'll take that down with me and find out who's going to be in charge of the second appointers. But the greeters will come to me, and I've got the script all ready for the greeters to use.
Great. So since you need to get going, I just want to thank you and Lauren Carroll. Thank you both for being here. All of your work is so appreciated, and thank you all who volunteered. And so I think we'll call it Rotary for the day unless there's a burning question. Great, thank you again.
Thank you.
Right.
Bye-bye.
Thank you. Have good days. Tom, thank you.
Hey, Lori,
Yes.
what's the afternoon on Saturday look like for the second appointment people? Do you need more volunteers for that?
Well, I feel like I've been told by somebody else, not Dorotha, that they're going to handle that in-house and really don't want, that's a poor choice of words. So I think everybody who has been assigned to be second appointment people, they're going to get new assignments.
Okay, because I know how to run the software, so if they need help after, I have a 1:30 shot, so after 2:30 or so, I can help if needed.
Okay, I will put that on the list, and I'm hoping I'll hear, Will.
Yeah, if you don't, that's fine, but if needed Saturday afternoon after 2:30, I can help.
Okay, sounds good.
If we haven't heard from you or anyone, then we're not on the schedule for helping.
But you are, Tom, right?
I didn't see anything.
Oh, but I know that you are.
Okay.
So-
Saturday.
Yes,
You're all day
Saturday.
Friday and all day Saturday.
I'll dress really warmly.
Will is such a good guy.
So whatever you told me you were going to do, but I put you down as a second appointment person. And
With
so,
the software, huh?
right, but you're not going to be doing that because I'm pretty sure that whoever I talked to this morning said they have other jobs for people. So let me get that list to Dorotha and look for an email tonight.
Okay.
Okay.
Thank you.
Okay.
And Lori, this is Paul. I'm available, so if you need an alternate to slip on any, like the outside stuff, the parking lot or anything, I can do that. So just let me know.
Well, is there a day that's good for you, Paul?
Well, I'm getting mine at 4:45 on Friday, so I could, and Tina's coming in at 1, so I could be there in the afternoon, or it doesn't matter. I can make it either anytime you need me. I'm not signed up in a slot.
Okay, my experience in this is that it's helpful if people are signed up in a slot. And so if I can put you down for Friday afternoon, that would be great. And your appointment's at 4:45?
That's correct.
Okay, so I will only have you until like 4:30, okay? All right. Great. Well, we
I'm-
appreciate that.
I got a
Sorry,
quickie
what-
for you on the time. Oh,
Yeah. And-
Hey, Vince.
I'm sorry, go ahead, Vince.
No, I don't want to interrupt either, but yeah, I would expect most people the 15 minutes. Most of the reactions I've seen at our clinics have been anxiety related. Where people will really, because you really get in your head, am I feeling this? Am I not feeling this? I'll tell you, your arm is going to hurt, and possibly for 3 days. But the rest of it,
that.
it's gonna hurt. No, if it doesn't hurt, when I got my second one, I was waiting my 15 minutes. I actually yelled over to the nurse that gave it to me. I'm like, are you sure you gave it to me? Because it didn't hurt. But later that night, it hurt. And that was the second one. I actually did better on the second one than I did the first. So again, for that 15 to 30 minutes, we aren't seeing a whole lot except for anxiety. But with the first 24 hours, we've definitely had people with the fever and the aches and everything. So, but that's about it.
Well, thank you.
But it
And
hurts. Sorry.
And you've heard from the hospital, Vince. Are you going to be giving?
Yeah, I think they switched me. So I don't know. I'm sort of hoping you didn't put me on a list because I'm getting some emails from Nicole that she switched me.
Yeah, I did not put you on the list. I said you and Christy were available to do vaccinations, and that's how I let people know. Okay.
Well, initially she told me I was going to be doing the second scheduling, and it looks like she might have bumped me up to a vaccinator. So I just got to make sure they have everything they need from me.
Okay, that sounds good.
All right. So you guys. Oh.
Yeah. Bye, Vince. Well, just tell me once again when you're available if they need schedulers.
Oh, myself?
No, Will.
Okay, I'm leaving. Bye.
Okay, bye, Vince.
I have a 1:30 appointment for the vaccine on Saturday.
Okay.
And, if that takes an hour, 2:30 to the end.
2:30 to the end on Saturday. Okay, let me get this to people. Thank you so much. We appreciate it all. And Tom, thank you again.